today's recognition is actually twofold and acknowledges two significant achievements taking place in our hospital today. The American Heart Association's Get With the Guidelines Bronze Award for Resuscitation recognizes the outstanding work of frontline caregivers who respond to code blues at South Georgia Medical Center. Now, a code blue is called when a patient's respiration and heartbeat stops. Today's award recognizes the efforts of those who work quickly to restore breathing and heart rhythms to save lives. South Georgia Medical Center is also pleased to report that it was one of 2 Georgia hospitals chosen to participate in a cardiology research study funded by the National Institutes of Health. The study is entitled Comprehensive Evaluation of Risk Factors in Older Patients with Acute Myocardial Infarction, or Silver AMI. Locally, a cardiologist, Dr. Trey Powell, and members of the Dasher Heart Center team will collect data from heart attack victims, patients ages 75 and older, who agree to participate in the study. The data will ultimately result in greater understanding of this patient's population's needs for greater specialization in cardiac care.
Both of these announcements are rooted in South Georgia Medical Center's long commitment to excel in patient care and outcomes. Every day, we have teams of clinicians and physicians around the world, literally, collecting data and working to improve clinical processes and outcomes and participating in research. Every advance we have in medicine, whether it's a new medication, or a new therapy, is based on that research. The Dasher Memorial Heart Center at South Georgia Medical Center is the region's forerunner in quality heart care. And it comes as no surprise that Dr. Powell and his team would choose to participate in this study. It's being conducted by Dr. Chaudhry from Yale University in conjunction with the National Institutes of Health. To be working with researchers from Yale is an extreme honor. There are only 2 hospitals in the state, South Georgia Medical Center and Emory University, who are participating in this study.
The National Institutes of Health funded investigators at Yale University to conduct the comprehensive evaluation of risk factors in older patients with acute myocardial infarction, or otherwise known as Silver AMI, study to better understand what's driving outcomes in patients 75 years and older who are hospitalized with heart attacks. The Silver AMI is a 5-year study that will enroll 3,100 patients from hospitals across the United States. The Dasher Memorial Heart Center at SGMC is proud to be one of 62 hospitals in the U.S. selected to participate in the study. We will conduct research to help develop clinical evaluation tools for application in the care and management of older adults who have recently had a heart attack. These risk stratification tools will then be used to help predict clinical outcomes in heart attack patients and help with medical decision making during the patient's recovery. People judged to be at higher risk may receive closer observation and or earlier treatment, while people at lower risk may be able to be reassured and managed more conservatively. With the aging of the baby boomer generation, the numbers of patients over the age of 75 who experience a myocardial infarction are expected to substantially increase within the next 30 years. The higher burden of these individuals suffering from multiple disease processes make this age group more complex than younger patients, and older patients are also slower to recover from heart attacks than younger patients as well. This study will provide critical information about the fastest growing segment of the heart attack population, which is the elderly. Although growing in numbers, elderly patients have historically been excluded from cardiology clinical trials, and as a result, clinicians are left with little information about how to treat these patients. Patients are also left with little information about what to expect. The information learned as a result of this study will help to bridge that information gap and improve treatment protocols for patients over the age of 75.
The American Heart Association's Get With the Guidelines Bronze Award for Resuscitation recognizes many caregivers who respond 24 hours a day, 7 days a week to the rapid intervention when a patient's heart and lungs stop functioning. In healthcare, this is referred to as a code blue when it occurs in the hospital. When a code blue is called, individuals from many healthcare disciplines rapidly respond to begin the code blue protocol. Now, the Bronze Award for the resuscitation recognizes our caregivers for successfully restoring the heartbeat and respiration rates in hospital patients who were found with no heartbeat or respirations in 85% of cases occurring from April through June of 2013. Resuscitation is a collective effort. Departments including nursing and patient care, the emergency department, pulmonary services, pastoral care, and members of the rapid response team have worked extremely hard to fulfill and utilize best practices and techniques that save more lives so that more people can be successfully restored.
It's great to be here again, back again. I'm really excited about it. Hospital has made some unbelievable accomplishments and efforts moving forward, specifically with the Get With The Guidelines Resuscitation Bronze Award. This is a collaborative quality improvement program, and I think the key word there is quality. This helps hospital teams save lives threatened by cardiopulmonary emergencies through consistent application of the most up-to-date scientific resuscitation guidelines for in-hospital resuscitation. The award is given for achieving 85% or greater on 4 resuscitation measures during an in-hospital resuscitation event. The measures are as follows, and I'm also going to give you the percentage that was accomplished here. These numbers are absolutely amazing. Percentage of events in adult patients who were monitored or witnessed at the time of arrest, 93% for this measure. Percentage of time to first chest compressions in less than 1 minute in adult patients, 100% for this measure. Percent of adult events with a breathing tube, endotracheal tube placed, which is confirmed to be correct, 100% for this measure. Percentage of event in adult patients with ventricular fibrillation, pulseless ventricular tachycardia, as first documented rhythm in whom time to first shock is less than 2 minutes of event recognition. 100% received for this measure. And I also wanted to mention that there's only one hospital in the entire state of Georgia that has received the bronze level of resuscitation for this module in this quality program, and it was received at the same time as South Georgia Medical Center. So both hospitals, it was during the same time period. And I'm going to, if I may ad-lib here for a minute, there are no other hospitals within, and when I say a 45-mile radius, you have to look at Alabama and Florida. So there's not another hospital within a 45-mile radius that has reached this level. I've looked at your data. I'm constantly looking at the data. You're well on your way to the next level, which is a silver award. No hospital in the state of Georgia has reached that level at this time. It's important, too, that when I'm up here, I want to make sure that I recognize our EMS professionals over here. They're an integral part of what happens at this hospital. If you don't have that collaboration and that effort and that partnership, then you're not going to be able to accomplish everything that you're able to do. And I'll be real quick, but I think this is an important, quick little story. I've been down here many times. Inevitably, every time when I go have dinner the night before, I'll get in a conversation with somebody. They ask why I'm here, and we'll start talking about the hospital. I can assure you, the citizens of this community are acutely aware of the great and quality care that takes place here. Just to share that with you, it always comes up every single time. That's what the citizens and your constituents are saying about the service and the quality of care, which we know is increasing patient outcomes based on the quality programs that you're using. So with that, you should be very proud of those accomplishments, and I look forward to seeing you guys sometime after the first of the year for your silver award for resuscitation. So without further ado, could you please join me in celebrating this outstanding accomplishment at South Georgia Medical Center.